7 million people in England and Wales currently take statins, reducing the amount of cholesterol in their body. Now the health watchdog NICE wants more people at a relatively low risk of a heart attack to take them.
A leading group of doctors disagrees, though, saying it can mean millions of healthy people would be taking tablets for the rest of their lives.
Joining us now is Dr. Kendrick, who's urging the health watchdog to change its draft guidelines. Morning to you. Thanks very much for joining us. So a lot of people take statins already. So why would they be taking statins?
Well, people take statins to reduce the risk of dying of heart disease. So that's the main reason, really.
But, I mean, who's it given to particularly? Are they are at risk already? How you know that because?
Well, they do a risk calculation, if you like, which is that if currently they say if in the next 10 years your risk of having an event, a cardiovascular event, a stroke, a heart attack or something is more than 20% risk, then you are advised to go onto a statin. So that's the current position.
Well, the NICE point of view is that cardiovascular disease kills 1 in 3 of us eventually. So these proposals intended to prevent many people suffering when they wouldn't, when they really don't need to.
Oh, yeah, I think everyone accepts the thinking behind it. Obviously, you want to be protecting people if possible, but we're moving to levels of risk that are really very small. And when you start looking at the data, if you use some of the risk calculators that they're now using and try them out in the real world, we're actually looking at even lower risks than. So if someone is calculated as being 10%, you could say, well, their actual risk is really less than that. And so the data is quite difficult to interpret, but we are putting potentially another 5 or 6 million people on medication, which I believe causes quite a lot of side effects for the rest of their lives, and the overall impact of that.
The side effects question is interesting, though, isn't it? Because, as you say, the data in that field is also complicated as well. And we don't really know exactly how many people do suffer from side effects, and they vary in degree, don't they?
Well, I do. I mean, one of the major problems we have is that the industry holds these data. It's very difficult to get hold of it, and when you do clinical studies, you're doing them on a very artificial population. I mean, on Monday morning I was doing the surgery. The first 3 patients who came in to see me were all saying, I'm getting really nasty side effects from taking my statin. One lady saying, I can hardly pick up a phone, for example. Unfortunately, we're told, well, that's anecdotal data, and anecdotes don't equal data. But the reality on the ground is that you do see an awful lot of people with significant side effects. And is it worth it? Because when we're looking at risks of 10%, the actual benefits, the benefit on, say, extending your life, is vanishingly small, if it exists at all.
So you talk about the lady who couldn't hold the phone. What other sort of things are people telling you?
Well, I think that a lot of them are, the side effects are quite subtle. I have a little saying to my patients, which is, statins add 15 years to your life. So they don't make you live 15 years longer. They just make you feel 15 years older.
Right.
And a lot of people do. It's very non-specific. It's pain, it's difficulty getting up, it's sometimes memory loss we see, it's stomach pains, sometimes irritation, mood changes. These are quite common things. If you don't ask for them, patients won't tell you these things, but the reality is they are common.
Just briefly, once you start taking them, do you have to stick with them? Can you stop taking them?
Well, the plan is you take them every day of your life till the end of your life. And that could be, in many cases, if these guidelines come in, for instance, I'm now 55, I hate to say I've reached that point, and I did my risk calculator on myself, and I should be taking statins. Well, I am not going to be taking statins. Recently, the BMA, the GPC, which is the General Practitioners Committee of the BMA, had a vote as to whether they believe these guidelines should be brought in, and unanimously they rejected them. So I think there's a great deal of concern and worry about this.
Okay.
Dr. Kendrick, thank you.
Thank you very much.